make everybody else wait. So thanks for coming. This is going to be kind of an overview. You've all traveled before, so you've all heard this before, but it's been a while since you traveled with us at least, so we should give you a little reminder about a few things.
Oh, I have to re-click on
There we go.
Let me move that out of the window.
Check his email. Takes too long. Okay, so most of you, I think, had your paperwork already completed. Anybody here haven't done paperwork? You're just waiting on yours. So, okay. So, don't buy airfare until Brad says it's okay to do so. That's just making sure we get all your paperwork processed, and the provost office gives us the okay. A lot of this says Kenya, and it's because I use Kenya PowerPoint to base it off of. So if you're not going to Kenya, just replace that with where you are going. But you need to make sure that your passport is valid 6 months from the date you return. So if it's not, you need to go ahead and get it renewed. As far as visas go, in your packet, which I'll go over in just a minute, I'll talk about the visas for Kenya in particular because I know those. If you're going through CFHI, you need to make sure you look through their documentation and follow their process for visas. And if you're not traveling on a U.S. passport, even more so, be careful about your visa status. But you will need a couple of pages if you're getting an actual visa in your passport, so just make sure you have plenty of pages. UTMB requires that students register for STEP, which is Smart Traveler Enrollment Program. If you are not traveling, if you're not a U.S. citizen or not traveling on a U.S. passport, you can check with your embassy. They all have similar programs. But this just takes a few seconds to do. Once you have your flight, you know when and where you're going to be, just go in and enroll yourself. For cell phones, for UTMB Kenya field site, you're going to get a cell phone when you arrive. There is a $50 deposit. That's just so that we get the cell phone and all of the chargers and things back. It's going to be a basic smartphone, so when you are in Nairobi, you can use Uber and things like that on the cell phone. If you are not going to UTMB field site, you're not going to Kenya, I believe CFHI also gives cell phones, but if they do not, you're going to want to get like a cheap pay-as-you-go phone or something. Because you really need a way to be able to contact people and for people to be able to reach you at least in an emergency. So I highly recommend you do that. Also in Kenya, you're going to get a USB modem with your cell phone. So you just load up minutes and the coordinator there will show you how to do that. So one thing that's important for all of you, and since you all have traveled before, you may already have everything you need, but just make sure you go out to the CDC website and check the recommended and required vaccinations for your traveling. If you need yellow fever, let us know. That's the vaccine. If you need it, let us know because there's actually only one place in Houston now that we've been able to find it because there's a worldwide shortage of the vaccine. So let us know and we'll tell you the clinic where you can go and get that if that's one of the ones you need or are required to have in East Africa. It's usually required. So for everything else, Blue Cross Blue Shield, your student insurance, if you're on UTMB, student insurance has some coverage. You'll just have to check with them. But if you're on your parents' plan, just call and check about travel health coverage. Some plans have none. Some plans have complete coverage for travel health visits. You can use CVS and Walgreens. If you want to see a provider, Dr. Yannick Patel does a travel clinic. He's actually a PDID doctor here if you don't know him, but he will see adult patients and he has offered to give our students a discount. the office, this is if you're paying out of pocket, not with your insurance. So the office, if it would be $50 if you're just paying out of pocket. But when you get these by email, those links will work and you can go and look at their prices. Most of the first year students last year kind of made a group appointment with Dr. Patel and took care of everything. Student health is actually quite expensive now because they're not playing nicely. I forgot this is being recorded. They're not playing nicely with our students. So, it's travel health. So make sure you do that sooner rather than later. So as far as in-country logistics, if you're going to Kenya or Uganda, all of the in-country logistics are handled by a logistics coordinator. If you're going through CFHI, they also have your logistics handled as well. And they're going to provide you with all the materials you need to know. If you haven't already received like a handbook about their programs, you will soon. As always, leisure travel is your responsibility. We don't want you leaving the field site early to do leisure travel. You know, if it's Friday afternoon and you're not really busy, and you know you're not going to be busy, just ask and let the preceptor know that you're going to take off a couple hours early. Just ask, but don't take off like days at a time. We want you there through the work week. And Kenya, the logistics coordinator, she can help you with leisure travel. Just give her a little notice so she has time to look at some vendors and get some pricing for you, but she's actually really good. There are a lot of kind of pseudo vendors in Kenya and elsewhere too. So you want to make sure you go with a reliable company, not just like a website that's going to take your money and then there's no actual tour company behind it. So always ask for suggestions on who to use. Definitely make a communication plan with your family. I know you guys are fourth year medical students or third year medical students, some of you online. But it's important that your parents know how to get in touch with you because they do call us. We have more calls from parents of fourth year medical students than we do of first year medical students. Kind of backwards to me. I would think, they're maybe more inclined to call about first year students. But don't forget that, you need to text them or send them an email, once a week and say, hey, I'm still alive, everything's going well. You can give, and my contact information is in here, and you can give it to them because what happens when they do call is they call like the president's office or the dean's office. They don't know where you are and they just freak out. So if you have your parents or your significant other call me, I'm more likely to be able to find you quickly than the dean or the president. Just a little bit on safety. There is a travel warning for Kenya. For those going to Kenya, please go out there and read it. They do update it every so often with places you should avoid, that kind of thing. But this is general travel advice. Just remain alert and aware. Travel in groups. Do not walk anywhere at night, even in groups, no matter where you're going. Always take a taxi or Uber or something. But especially in Nairobi and Maua, for those who are going to Kenya, do not walk at night. Now is not the time to become politically active, and at least abroad. I mean, do whatever you can here in the U.S., but abroad, don't become politically active. And if you fall into the LGBT community, just make sure that you check local laws and cultural norms and try to stay off people's radar. So for leisure travel, we can't forbid you to go anywhere on leisure travel, but UTMB has informed us we have to give you this policy, which means we are best able to help you if you follow the International Travel Oversight Committee's recommendations, which is a committee here at UTMB. This is especially applicable to Kenya. So it's no travel to Mombasa or the Kenyan coast, no travel near the Somali border, and no visiting the Kibera slum in Nairobi. So if you stay away from these areas, we are best able to help you on leisure travel. If you go to these areas on your own time, so not during the rotation, you can't stop you, but we're also going to be less able to help you. If that makes sense. Brad's going to give you a form. You don't have to let us know that you're doing leisure travel, but we're better able to help you if we kind of know you're going to be out of town, where you're going to be. That way, if something comes up, we need to contact you. We do that. So there is some required insurance. All of it is provided to you by UTMB. You guys are familiar with SOS insurance. You had it your first year. I don't know if you guys had the travel health insurance coverage your first year, but now we also have travel health insurance coverage, and it's also provided to you for free. The way you activate your travel health insurance, let's say you get sick, you need to go to the hospital or a doctor's office. You call SOS. You tell them you're a student, what you need to see a provider. They will tell you where to go, and they will work directly with that provider to cover the expenses. If you just go to whoever without calling, they may or may not take the insurance. So it just depends on, if you're in Nairobi and you want to go see Dr. Ah Cheng, who's the mentor, then, she'll probably just treat you for free. But if you need to see somebody else and she recommends them, you want to use them, they may or may not take the insurance, so you'd have to pay out of pocket. We do recommend for students going to Kenya, for sure, that you purchase travel insurance that covers trip cancellation or trip interruption, and make sure when you're looking at the insurance that it covers those things for any reason. A lot of times the insurance will only cover trip cancellation or trip interruption if the State Department pulls out of Kenya. We have a little bit higher threshold or lower threshold than the State Department. So if something happens in Kenya and we need to get you guys out, we don't want you to lose a bunch of money in the process. So this is mainly only for Kenya because of the State Department warning, but also good for anyone else just to protect your trip. And then when you purchase it, it's relatively inexpensive, around $100 or so, if even that. So I'm going to go through this real fast, this packet that you've all been looking at. So we have this wallet size emergency card in here that has information for international SOS, a local contact number for you, and the UTMB emergency line. So that line is answered 24/7, 365. So it also has the U.S. Embassy number on here. And there's an email address you can use, so if you're having a real emergency, some email, just call. So this is good just to keep with you in your wallet, your purse. We also have a full page that you can keep somewhere else in your apartment, in your room, that has all the same information.
If you're going through CFHI, you can get the information from CFHI, or depending on which location you're going to, all that information from the U.S. Embassy and phone numbers are all out there if you want to go and fill out your own form. It's just I don't have that information off the top of my head, so I left space for you guys to fill it in.
The CFHI will provide all that to you. Make sure you program the emergency numbers into your phone and try to memorize at least one, preferably the international SOS number, because if something happens, you lose your phone, you need to be able to get in touch with somebody in an emergency. You need to know it. In your packet, there is also a document that says logistics information. That is going to have our emergency procedures as far as who to call, when to call, if you're involved in a theft, you have personal injury, or worst case scenario, a terrorist attack. So I'll let you read all that on your own time. It's fairly straightforward. Again, this is the emergency hotline for UTMB. It's going to be answered as UTMB Maritime Global Health, as Texas A&M Galveston also uses this number as an emergency hotline. So that's why it says that. Here's my contact information. If it's really something urgent, call me whenever. If it's not something so urgent, please don't call me at 3 a.m. But you can get a hold of me on WhatsApp pretty much all the time for anything. If you're having trouble with your coordinator or you have questions that you need answers to, just let me know. Just going to go over a few behavioral expectations. You guys all know this, you all travel, but you are our ambassadors to these programs. So we want you to, behave and put your best foot forward. We cannot possibly go into all the cultural and social customs for where you're going in an orientation. So please, look into that, buy a guidebook, ask questions of the programs you're going with if you have anything that you really need to know. Always arrive on time for your rotation. Even CFHI, they let us know when our students are not arriving on time. So even if you're not a UTMB field site, they let us know that they've had some trouble in the past. So the work week is Monday through Friday unless it's otherwise arranged. If you're going to have to work on a weekend or there's something you're going to do on a weekend, like a community outreach program, you're going to know in advance that that's happening. Dress conservatively, avoid offensive language. When you get this, please go to this link if you're doing a homestay. There's just some etiquette out there and some things that you may not think of. Just remember you're staying in somebody's home. They may or may not be more conservative than you are. So just remember to respect their rules. If you're going to Kenya or Uganda, you're staying in mission-affiliated housing, even in Nairobi, at the guest house. So just be respectful of the rules. No drinking on campus or in the apartment in the guest house. In Nairobi, if you go out and have a drink, just don't come back drunk, essentially. And your East African colleagues, they may be drinking and doing things that we've told you not to do, but just know that you're going to be held to a higher standard than they are. And if you have a question about appropriate behavior, just ask someone. So Brad's probably already emailed you about assignments and what to do, but we have a pre-departure training, which most of you have already done the interprofessional course, so you're good to go on that. There's a GAP certificate, which is Global Ambassador for Patient Safety, and Dr. Dash is going to talk some more about that here in a minute. There's a pre-departure worksheet, a post-rotation worksheet. We want you to take the rotation worksheet with you. You can print it off of Blackboard, I believe.
It's also in your packet.
Okay. But because it involves asking questions of your preceptor while you're there to get to know local, what's happening locally, things you can't find online. There's a short reflection assignment, and then we have you bring back a preceptor evaluation. That's especially important for you guys going to CFHI because it's the only way we know that they found your performance satisfactory. So make sure you take the preceptor evaluation with you, the printed copy, and that you get it back from them before you leave. Otherwise, you may not get it back, and then we'll have a hard time getting your grades in. Here are some more resources. Again, Brad's going to send this to you electronically so you can have the link. At the very bottom, there's this rough draft of a travel resource document that we've been putting together. And it is a rough draft, but it has a bunch of different links to things that you may find helpful, and it's kind of broken out by country too. Just in your packet, real quickly, you don't have to fill this out, but it's something that you sign, the roles and responsibilities for students. Just make sure you take a look at that and what our expectations are of your behavior. There is a SOS card you can cut out and keep with you if you want to, and this page also has information on the back on when you might want to call SOS. They also have an app, which I've never used, but could be helpful, so we put that information in there. Again, you have kind of everything I've just gone over in the PowerPoint and a logistics document that's specific either to your field site or says non-UTMB field site. We have some safety tips for students we'll just go through. And again, your preceptor evaluation, I think you guys have all seen this. So most of it's done electronically now at UTMB, but for international electives, we still use the paper copy. That's the post-evaluation worksheet, or the post-travel worksheet is what it looks like. You'll do it online, but the questions and things you need to look for are printed out here so you have them. This is the leisure travel notification form. Again, you don't have to do it, but it just helps us help you if something comes up while you're on leisure travel. And then this is just a printed copy of the PowerPoint. Does anybody have any questions about the logistics side of things? And feel free to email me or ask me questions later. Dr. Dasho is going to talk a little bit about clinical expectations and a reminder about ethics.
So I just want to say real quick, everything that was in the PowerPoint is printed out for you. I've also sent you electronic copies of everything, which you'll receive probably 2 or 3 more times before you leave as reminders. And for those of you that are online listening, if you want the printed documentation, just shoot me an email with an address and I can mail it to you. That way it'll get to you wherever you're at, or you can pick it up from me in person at a later date.
I have some online.
Okay, cool. Hey everyone, good to see you guys. I can't believe you're going on a clinical elective. You're still first years. Where's everybody going? Where are you going?
Philippines.
Oh, that's yeah.
Manila. India. Ecuador.
Nairobi.
All right, cool. Oh, we got a bunch of people online. Great. Okay. Cool. Yeah, we wanted to do this because what I realized, Kaylee and I were talking earlier in the year, and we realized that we spend all this time like prepping you in first year, and then you get to fourth year, and we're just like, okay, now just go do the things we told you in first year. We don't really come back and revisit sort of kind of the way of thinking for a clinical rotation, which is very different than a preceptorship. How many of you guys did clinical work or some form of like clinical observership in first year? Yeah, it's a little bit there, right? But this is all clinical. So, well, what do you? I mean, let me just hear from you guys. What are you kind of hoping to get out of it? What are you hoping you're going to see or experience? We can just go around.
So I'm doing remote. We're both doing remote island medicine in the Philippines. So probably just seeing the tropical diseases that we learned about in class that we took. And of course, like getting to know culture.
It would be nice to have a little bit more responsibility than we did first year, to have a bigger role in patient health care.
Sure.
And
I'm also looking for like all of that and like also seeing how different areas like practice medicine.
Awesome.
It's more like learning clinical stuff. This first year we didn't know anything, which is like shadowing, but like now we going through third year, like like all this stuff. I'll have a better idea of what's going on.
Great. Yeah, I agree.
Yeah, all of that, and then I really want to get some medical Spanish under my belt. Patients.
Yeah, it's awesome.
I'm looking forward to getting like a greater diversity, like on the medicine boards of cases and technology.
again, all of that plus, kind of what Sarah said, learn another language, kind of practice medicine, especially with that.
Fantastic. Where are you going?
In India,
Okay.
I think with Kenya, the public health program there, Delhi.
What are you hoping to get out of it?
Just kind of more exposure to public health, because I know some of my friends went to get MPHs. I didn't, so it'd be cool to at least, kind of see a little bit of what that's about.
There's always the chance.
Yeah, well, apply to residence. Yeah, for a while.
I think those are really good. Those are really good goals. It's first the first step you've already done. So you've actually articulated what you want to get out of it. What happens sometimes is students, and I speak of this from the experience of sending students on international rotations, but I spent some years receiving students as a host in another country. So I spent some time receiving clinical students. And what I would notice would be that there was a gap between what students thought they were going to be able to do or get out of it, and then when they walked into the local context, what they were actually able to do. And so, from my end, I think it's very important to make sure that you have very clear expectations. And I think just by setting yourselves up as you have, I mean, you've said all the right stuff. I mean, observing different spectrum of disease, seeing how a different health system works, learning a different language. I mean, those are really good goals to have. The ones that had problems were students that, and this has been consistent whether I've sent students or received them, is when the message is that, okay, you're going to go and you're going to move the needle, right? Like, I'm going to go, spend 4 weeks, and I'm going to save lives. I'm going to provide all of this service, and that's not a bad thing, because that's why we're all here, right? I think we're all in medicine, so that's kind of what we want to do. But the ones that had the most success were those that went and said, I want to be a part of this. I want to help out wherever I can. But what are some challenges you think you might encounter in a clinical setting in these places you're going to go travel? What are some of the challenges you think you might see? We can start over here.
I think communication. We even have communication issues here in English, so I'm actually a speaker somewhere there and don't speak the language.
Good. So communication with other health, other members of the team?
Or family, patients.
Patients. Huge. That's great.
Probably cultural. At least, obviously we have those differences here, but me going to a completely different culture, but not much of the language under my belt, and maybe there's different cultures of how to approach or how to speak respectfully.
Yeah. Kind of knowing when you've stepped in it. Yeah, totally.
Yeah, absolutely. I didn't know my mouth was big enough for both of me to fit in there.
Too hard on yourself, Dyer.
I would say taking what I've learned about medicine in these last 4 years and then having it kind of being challenged, like in Nairobi, they do things differently there in terms of diagnosing, treating, so it'll be a little bit harder.
It is. That's actually, I'm really glad you mentioned that. That is really hard when, you've learned things a particular way and you feel pretty confident about it. And then someone with more authority than you, challenges you on it and you're not really sure what to do because I'm pretty sure this was in first aid and I'm pretty sure that this is what my faculty did. But negotiating that challenge, do you challenge that authority? Because I will tell you, there have been cases where, a student was right and the supervisor was wrong, but it's at the end of the day, what's hard, I think, for students is that they're going to do that. They're going to do it their way anyway. And I saw this even as a colleague. There were times where I would see an egregious error, and then what's your role, right? Am I there for the patient or am I there for the partnership? And that's a crappy situation. I hope you don't find yourself in. A colleague and I had, and you're not always right. Sometimes they're right and you're not right. But when you're in that situation where kind of on the cultural side, at the end of the day, you're going to leave in 3 or 4 weeks and they're going to still be there. So we would say, those of us, we lived there and we would say, boy, how many people are going to die so that we can have a good partnership, right? So it's a tough part of global health is finding that balance. So I think the people who succeed are the ones that have a little bit of there's humility obviously, but then there's also that, okay, well, I'm going to learn from this. And I don't have a good answer for how to negotiate that, but it's something that almost certainly you're going to run into. Is when there's sort of pretty sure this is how it's supposed to be done. I would manage it like you manage it here. There are times where your attendings were probably a little bit in the wrong, although we do know wrong. But there may have been a time where, but I think then it's maybe talking to the other students or talking to some of the residents and just saying, hey, I learned it this way. You definitely don't want to challenge the faculty. That will be a losing. He'll lose, I'll lose, you'll lose, everybody, the patient's going to lose, everybody's going to lose. What about you?
I think adapting into a new medical culture, because I feel like here I definitely know my role as a fourth year student, and like even day-to-day tasks like what fall to me, but going into a different environment where you like learn how their medical culture operates, and then like, what my role will be there for within the team and then for the patients.
Yeah. That's huge. I mean, here there's this like established hierarchy. You kind of know where you are in the pecking order. And then there you still are in that pecking order, but it's a different pecking order. And sometimes, so one of the things is that some students deal with is the awkwardness of the fact that medical students at your level there do different things than you do. Right? So a medical student there in their senior year might be relatively independently doing procedures, for example, right? And I think it's very important to set those limits on yourselves, because you can certainly find yourself in situations where they just hand you the LP kit and they're like, or where there's no kit, they just hand you the IV tubing and the 18 gauge catheter and say, hey, go do an LP on this guy. And that's the time where and you are in the hierarchy, but that's your job as the student. And that's where you should feel very liberated to ask for help. I would say don't, if I gave you that opportunity on the wards, you wouldn't turn it down. But you definitely don't want to do anything. I would say like you don't want to do anything unsupervised there that you wouldn't do unsupervised here. And that was often a conflict with students. They came really wanting to do procedures, but then were put, in situations where they didn't have the appropriate supervision on practice to be able to do it. So make sure you get help on negotiating the hierarchy. You're going to Ecuador, right? So there may or may not be other students around. So just be cognizant of how you make these. Because, senior medical students, I had this argument, I think I may have told you guys about this the first year, but when we were sending students initially to Uganda, I had the first year students called me. This was the second year we'd sent students, and they said, hey, we're not really sure what to do here. The faculty or our supervisor just asked us to start putting in IVs and putting in Foley catheters, and said by the end of the rotation that he wanted us to be able to do a C-section. And so we had to have a talk, and it was a very important conversation. He was like, listen, fine, okay, no C-section, but come on, Foley catheters? Like and IVs, I have my first year midwife students doing that. It was challenging me. Are your medical students no better than my first year midwife student? I said, we just had trained in a very different environment. It was there, so there's some of that is on your supervisors. They should know, especially if you're going through CFHI, they know exactly what you can and can't do. So, but those are some things that have come up in the past.
How would you say language and communication with the people working there, like the students and the faculty, as well as just with patients? Because I remember going to Africa, we never talk to anybody patients wise, we just speak the same language. So just trying to understand what they're trying to say. So I feel doing a clinical away international clinical rotations great, but at the same time, so I feel sometimes we don't get the full experience out of it because we can't communicate.
Yeah, and I think that is a good point. A couple of you guys have mentioned communication. I think you can't emphasize that enough. That it's about expectation, right? So if you're in a place where you don't speak the same language as the majority of people, your expectation should not be that it's going to be like a clinical rotation here, where you're going to take a full history, do a full exam. You may be limited. One of the things that sometimes happens is that there may be other students around that can help translate. That can be very helpful. But you don't want to lean on other people for translation too much, right? Because we would have students in the hospital in Botswana, and they would ask the nurses to come help them translate. The nurses got really angry. We're not translators, we're nurses. You know, we're not here to translate for your students. And so it's finding a balance, but also having an expectation that you're really there to see and experience the spectrum of disease and the health system that you're going to be working in, and kind of see. This is also part of it is like taking home. Where should I, if I'm going to do this work in the future, where should I do it, and what requirements should it be a place where I speak the language that if I want to really engage in patient care, I probably need to speak the language. But I think most places will try to make it so that you can still engage in patient care. Just, you're right, it won't be as intimate as a place where you speak the first language. But
With language and culture, like both between the patient families, and also like what you were saying, the medical culture too.
Yeah, and what you'll see is sometimes especially if you're rounding with faculty from other institutions, other countries, is that there can be a bit more like teach by shame than we're used to here. Like we've kind of flipped the needle a little bit. We've gone away from that in medical education. We don't like embarrass you on rounds or make you do a full physical exam in front of other people and humiliate you while you do the wrong thing. But in some places that still happens. In the Dominican, where I remember as a resident when I rotated there, it was almost a militaristic hierarchy. Like the fourth year resident bossed around the third year resident, the third year resident bossed around the interns scudded out the student. It was just like abuse all the way down the chain. So I don't think you'll run into that because most of the places we're sending you, they're very kind people. But and they receive a lot of students. But and then as a foreign student, you're kind of like outside of that a little bit. But it's interesting. It's very interesting. So what about you guys?
So communication is going to be a big issue, especially being in remote island medicine. And I feel like seeing how medicine's practiced in an area without resources, like we're not going to be able to pan CT everybody, so I'm going to have to learn how to do a physical exam.
You're telling me I didn't teach you that? Yeah, no, it's quite true. And it's a frustrating thing too. I mean, just having trained here, you've been on the wards, someone's got a back, they get a back MRI. Someone's got a stomach, they get a stomach CT. And it's a very different way of practicing when those things aren't there. And it can you can feel extremely limited. But I think one of the other things that indubitably comes from it is just when you don't have those things, it's almost like having one of your senses, what they say about someone who is blind or who is losing their hearing, the other senses become stronger and you become very acutely aware of the epidemiology. Like you just learn, okay, well, in the Philippines, when people come in with cough, let me look at some studies and see if anybody's studied what is the most common cause of pneumonia in this setting. And you're going to feel that someone comes in with fever and cough and you listen to them and they have signs of consolidation, and your x-ray is almost now negligible. You don't need it. And now you know the epidemiology, so you know antibiotics to use. So you'll start thinking that way. And it is at on the one hand frightening, but also on the other hand quite exhilarating. What about you?
Yeah, so I'll kind of echo what other people have said. Communication and culture. I guess just speaking from an experience that we had in Uganda first year, we went into it without knowing, I guess, some of the common things that people would know when they're there, and it wasn't that we meant to offend anybody. We just didn't know, and so I'm kind of scared that might happen again. And so just like Kaylee was saying, we don't, you guys can't tell us everything that we need to know about every country. So just looking into stuff.
Yep. No, that's quite true, and boy, even sometimes we step in it. Faculty, your bosses are not exempt from opening their mouth out too wide and sticking their feet in it, or not causing an international fracas, but saying the wrong thing at the wrong time, or even just like dress or attire, and I think with the appropriate dose of humility, it's okay. Just the people around you are there to support you, and so are we. So like if there's any question about anything, I wouldn't feel like sometimes we put a lot of pressure on you guys. Like, you're our ambassadors, you're like diplomats, but you're students. We understand that, and it's most important for us that you guys have a good experience and you learn something and you get something out of it that helps you, in your career. So, we try to set things up so there's as few opportunities to fail as possible. But that's also how you learn. So, I've had students that, they were so heartbroken because they didn't ever mean to offend anybody. Students that got caught in the middle of did you guys do the MMIs? Right, the ones for global health. So one of the cases was based on student experiences. We sent our students somewhere, and there was a party. And it was like a going away party for one of the medical officers at the hospital, and they were the medical officers were not super religious, but they worked at the hospital, mostly hired by the government. So, they were just like everybody else, and they, had a party and they had alcohol there. And it was funny because we sent these students, they didn't drink. Like they were all three very religious, and they didn't drink. One of them was a Mormon. So even her being around alcohol was sort of like pushing the limits. And so they saw what was happening and they left. But then just because, just because someone had said, oh yeah, this UTMB students were there, they assumed that they were the ones who brought all the alcohol, right? We fixed that, right? But it's some of those things, and I'm going to say you shouldn't avoid fun. You should have fun. Mingle with local people, don't say, well, my faculty said I couldn't come party with you guys. Sometimes that's where the bonds happen, is spending time with people and enjoying yourself. But it's just, especially if you're going to being cognizant of the rules of the program is what I'm saying, where you are. They should be pretty clear about that. If it feels wrong, it probably is. But we get it. We understand. But yeah, it is. A lot of those things are challenging. I think if you put the appropriate, again, if the expectations are right, which is I want to get out of this as much as I can, you may find if you find the communication barrier makes it so that you can't really help take care of the patient, and you're not going to be able to learn the language in 4 weeks. There are other ways to be a part of the team and to help out and to really impact the care of that patient, as you guys know from being medical students. And I'm always telling the teams, we don't want to scut the medical students. We don't want to scut them out so they're buying coffee. But there's a difference between helping get records or get results or getting things for the team than getting coffee. There's a big gap. So, involve yourself in things. And especially when you're going into places where there are existing teams of medical students and interns and residents, they may not always know what to do with you. So just find one and glom on and just ask a lot of questions and be engaged and interested, and you won't get left aside. Places like University of Nairobi, they receive a lot of students. It's easy to get ignored, and it's okay to not get ignored. It doesn't mean you have to say, teach me now, teach me now, teach me now. I want all the teaching. But ask questions, be engaged. What else are you concerned about, or the things that you're worried about or you have questions about, burning issues? About you guys on the phone, I don't know if you guys can talk or not. Can they talk?
I think they've just muted themselves.
That's really kind. Thank you guys.
I can talk.
All right. Hey there.
Hi.
Do you want to say something?
My name is Simran. I'm going to Argentina for mostly a medical Spanish and social medicine trip.
Okay. Excellent.
And is there any question? Yeah, is there a
Just,
question? that I
anything
can
you're
answer?
worried about? Anything you're excited about?
I'm excited to the cultural immersion that's going to come with this trip, and then, as I think most people have mentioned, learning how medicine's practiced in a different part of the world and seeing how I could possibly fit into that in the future in my career.
Yeah, I always say I think that's a really good attitude, and like we were talking about earlier, like there will be conflicts with the way that you do things. And I think some of it is respecting the local expertise, and that these people have been treating this stuff forever. And you also have to kind of decide where your line is, right? If it's like, well, our guidelines say that we start with a thiazide for blood pressure, and I see that you started with a beta blocker, that's that's pretty weak. They're gonna be like, what is this? Who is this person? Whereas, I mean, the instance I always think of is a patient who had a question of a pericardial. We didn't have an ultrasound, and there was a question that this person may have had a pericardial effusion. And so we had a big heart on the X-ray, had some of the physical exam findings, but it wasn't convincing. And the guy with no echo or anything, I mean, did an unguided pericardiocentesis that I'm pretty convinced resulted in the patient's direct death. So, I mean, they took out the pericardial fluid, but it was clotting blood, so it probably went right into the right. And they died shortly thereafter. We're like, wow. Probably wouldn't have advised that. We probably would have waited. But at the end of the day, this guy's going to do that. He's going to do it again. Part of that is learning. That it's kind of like taking those experiences and putting them to long view. Like, all right, what am I going to do? How am I going to form partnerships in my career to be able to help those things not happen? Right. I mean, part of it was this guy didn't speak the language. He was a foreigner from another country, and in the way of practicing, there was a lot of there's just a lot of factors. How to negotiate that conflict is actually one of the most important things in the world. Is figuring out how to engage with people who think differently than you. And nobody's cracked that code yet. I promise. I promise. Thank you, Simran. You want to say something else? I see a microphone.
Oh, no, sorry.
All right.
No, I don't have anything else to add. Thank you.
Yeah, so seeing different cultures, seeing different healthcare systems means seeing and appreciating. And what sometimes the students that I would receive from UPenn, they would say, well, at Penn we do this. Well, here's what we do it, and you can't say that. You're not there. There, you can't say those kind of things. So, one of the things that would get people angry was that. We had an ICU that only had 4 beds in it, and so you imagine a 4-bed ICU for 2/3 of the country. That's what it was. And so the ICU guy was, we would say, hey, you got to take this guy into the ICU. He has pneumocystis, but he would say, no, pneumocystis patients die on the bed, right? And he's actually right. They do better with non-invasive ventilation than invasive ventilation, but these patients start decompensating, and both residents and students would get really let's call a code, right? We got to call a code and intubate the guy and put him in the ICU. And no, man, there's 4 beds. 4. That guy is the gatekeeper. So if you take up a bed with a patient that they know is that that has a 90% probability of dying. So that's the hard part, right? N of 1 medicine that we practice here, versus public health style medicine, which you practice in other settings. And I think that is one of the hardest things, is to say, okay, is this worth the resources? If you asked any one of us here, of course, we've got to give it a try. Right? We're not here for the system, we're here for the patient. And in many settings, you're there for both. And I think that's a really hard thing to do. It also is, I think, one of these things that clinical rotations give you an appreciation of is is the role of all of the upstream determinants. As much as you've seen that in the clinics and the wards here, poor people and immigrants have worse access and poorer outcomes. It's the same there. I mean, you got someone who's coming from, someone who comes in who's got a stillbirth because she couldn't access transportation to get to a birth facility to be able to have her kid. So she tried to have the kid at home. Didn't work. They got transport, but it was already too late, and now she has a stillbirth. And sometimes the international rotations, the first times that, and you guys have, you've been here, so some of you have dealt with death and grief and all of that, but, some people, we don't really see kids die, right? And sometimes you see kids die. I mean, that's just terrible, but it's one of the things that I think I want you to at least, it's not to depress you and to say that, you're going to see terrible things, but, things are different. I want you to be prepared for that. And I want you to also feel comfortable, when you come back to write about it, we meet about it, talk about it. Sometimes that takes some processing. Seeing the different system is great until when you see the problems in that system. I had this cardiologist, faculty, right? Well, he wasn't really faculty. He was a private practice guy. He was about to retire, and he came to Botswana to come and do a 3-month experience. And we were like, here are the 3 things we want you to do. Round with the team, show them how to use the echo, and show them physical exam findings that have to do with the heart. Those are your cardiologists do those things. And he was so happy for 6 weeks. And then the last 6 weeks, he got a bee in his bonnet about hand hygiene. He realized that people weren't washing their hands between patients. He said, this is unacceptable. I said, you're not here for hand hygiene, you're here for the heart. Focus on your organ. Stay in your lane, bro. He didn't stay in his lane. He came all over everybody else. So he, in fact, took it upon himself to make an appointment with the hospital superintendent to address this problem of hand hygiene. And the guy was so nice. He received him. He was this white-haired guy, older guy, and of course, he was never held a faculty position in his life. He got to be called Prof because he was an old white guy with long white hair, wore a long white coat. So Prof made an appointment with the hospital superintendent, and it didn't go anywhere. He left, but then we were there to kind of clean up that damage. So it's hard when you see stuff but sometimes the easy things have easy solutions. Students have made a big difference when they've seen something and said, hey, what about this? Could this be an interesting thing? And then all of a sudden you've changed the practice that has influenced lives. So doesn't mean keep your mouth shut. But I think you're going to have an amazing time. You're going to see stuff. Hopefully it'll be a good experience for you. Hopefully you get what you want out of it. Hopefully it doesn't turn. I always say that there's the 2 extremes. The majority of people do an experience like this and they say, yeah, this is it. I'm sold. Others come back and they say, never again. I feel like I'm just not the type of person that can handle this degree of sort of systems problems. I need my system. And that's okay too. Totally okay to have a bad experience. I mean, not a bad one where get hurt or something, but I want you to feel free to come back and we talk about those kind of things. All right. Cool. Thanks to you guys for being on the interwebs. All right. Anything else, guys? Any burning issues, questions? Was this helpful to just chat through things? Good. I didn't depress you, did I? No. Okay. Cool. All right.